When a woman's uterus develops differently, this is called a uterine malformation or a uterine anomaly. This does not occur very often. It's like for 5% of the general population. But if a woman has a history of miscarriages or a history of premature delivery of babies, then this increases like 25%. Up to now, there are 3 well-known classification systems for uterine anomalies. All 3 have some serious limitations. A very well-known is from American Society. Much more recent one is from European group. We just classify in general the uterine anomalies according to development problems. According to the American classification system, if the uterus does not develop, it's called agenesis of the uterus. It's not visible in any imaging techniques. Uterus does not exist. If one side of the uterus develops, it's called unicornate uterus. If diffusion problem occurs, it's called didelphys uterus. And the most common seen uterine anomaly is the septate uterus, which there is a lining which separates the uterus into 2 cavities. This is the most common seen uterine anomaly. These women with septate uterus usually comes with abortions, miscarriages, and preterm deliveries. A gynecological examination, two-dimensional transvaginal ultrasound is usually performed and can be used to diagnose uterine anomalies. But the better way of diagnosing uterine anomalies is like 3-dimensional ultrasound, which is a preferable way of diagnosing this kind of abnormalities. If you cannot have a 3D ultrasound, then you can have an MRI scan to diagnose the uterine anomalies. Uterine anomalies might not have any symptoms. When symptoms occur in a teenage girl, she might not have any bleeding, she might not have any periods, or she can have regular abdominal pains during the period times. That is a symptom at an early age with a serious congenital uterine anomaly. In other kinds of uterine anomalies, there are very different various kinds of uterine anomalies. Women can come to us with symptoms of recurrent miscarriages, baby losses, or a history of preterm deliveries. Many uterine anomalies does not require any treatment. If the symptoms are in a teenage girl with a serious uterine anomaly, then she can have some surgical procedures to correct it. In other women with uterine anomalies, if there is a problem of infertility, then the surgical correction by laparoscopy and hysteroscopy can be done to improve the reproductive outcomes. Many women with uterine anomalies does not have any problems with conceiving or delivering a child, but in some women, miscarriages or repeated baby losses or preterm deliveries are a problem. In selected cases, surgical correction with laparoscopy or hysteroscopy usually can be done to improve the outcomes.